All right, we're back on this Thursday night here on News Channel 5 Plus open line, and the lines are indeed open. 737 Plus is the phone number. We'd love to hear your thoughts on Tennessee beginning to slowly reopen the economy during this pandemic, and whether you think it's too soon, whether you think we have struck the right balance. Our guest tonight, joining us from her home out in West Tennessee, is Gloria Sweetlove, the president of the Tennessee State Conference of the NAACP, a civil rights leader here in Tennessee. No stranger to Nashville. You're a TSU alum, is that right, Gloria?
Yes, that's right.
All right, great.
That is correct. That is correct.
Good to have you here.
As we were,
go ahead.
Thank you. Thank you. As we were discussing before the break a little bit, you know, when you think about the people we represent, inequality and structural racism, it still remains a prevalent force in our country. And there are disparities in access to affordable health care. Our people are either uninsured or underinsured. Their jobs most of the time have no sick leave benefits.
Right.
So they have to go to work sick, even if they don't want to, however bad they feel. They got a lack of insurance, or else they don't have enough. So, and we are less likely to go to the emergency room, less likely most of the time to think, oh, it's sinus or it's cold, and it'll go away. So I'm concerned that, and then when I look at rural Tennessee, we don't have very many rural hospitals at all. And
so many of them have closed up in recent years.
Have already closed, yes. So when you think about that, within 45 miles in some places before you can even get to a hospital, you're not likely to go, even if you're sick. You're not likely to go. You're not likely to go to one of the walk-up clinics because you got to pay up front there. So, you know, the people that probably are at the bottom of the totem pole, these are the people that are hurt the most by this pandemic spreading, because, and if you think about New York and those places, we're the folks that are the frontline folks. You know, those are the folks, when you talk about working class folks, those are the folks that, you know, they're at the McDonald's, they're the cashiers, they're the bus drivers in New York and places, they're the subway attendants. Think about it, they are the people that do the janitorial work. They are the people on the front line, so they are the people that are more likely to get exposed. But at the same time,
I was a little surprised. Yeah, I was surprised by the numbers that you sent me here in this news release. In Chicago, it says here, African Americans account for 72% of COVID-19 deaths. Yet they're only 30% of the population, so there's a huge disparity there. Only 30% of the population. And then there's a parish down in Louisiana, St. John the Baptist Parish, a predominantly black community, chemical plants and oil refineries there, highest COVID-19 death ratio per capita in the country.
In the country, that's exactly right. Again, I say again, we are less likely, we're people that don't complain. I mean, you're talking about blue-collar workers that know I've got to go to work every day in order to get paid. They are not people that can work from home. So they've got to go to their jobs. And then they think about you come in contact with all kinds of people, and people often that, you know, are infected but might not have any symptoms at all. And think about, you know, I look at how now that we're sanitizing and washing down rails in public transportation and on airplanes and everywhere, people are washing down counters. But I mean, we weren't doing that. That was not happening.
Yeah, I agree.
You know, so people were touching things, holding on to rails on buses and subways, trying to get to work. I mean, they're the people in the front line. And so often, you know, they've got to go to work. I mean, if they don't work, somebody does not eat.
Sure. All right, so let's get back to our phones. We got a number of people holding. I'm going to go to line 2 and welcome Sharon. Hi, Sharon.
Yes, hello. Good evening.
Good evening.
Hi, how are you?
Doing well. Thanks for calling in. What's on your mind? Just turn your TV down or mute it. There's a little delay
turn
there.
it down.
Yeah, that'll confuse you. Yeah, go ahead.
I will say that I believe it's time to open Nashville, Tennessee on Friday.
Okay.
Can you hear me now?
Yes, ma'am.
And I believe it's time to open Tennessee up on Friday.
Okay, why?
I'm aware of the viruses has helped kill people. I have been praying for the United States, but I'm a person that had the swine flu. I've been through it. God saved me through it, and I know what it's like.
Okay.
If you have never had the swine flu or had the symptoms of COVID-19, you don't know what it's like. I had the mask on my face. I had the tubes down my throat, and I've been there, and God saved me from it. But I will say that people still have to go on with their life. People have to have surgeries. People have that are diabetics, so they have eye appointments, dental. People still have to go on with their life. And I understand that you cannot keep economy shut down for months all the way until August or September, because people have to live. They have to go to doctor's appointments.
Right.
That's important. They have
But
to
Sharon,
take care of their health.
do you feel comfortable?
And I understand that.
Do you feel comfortable with the guidelines that the state has put into place and the businesses and these, the safety precautions that they're taking?
I do. I feel comfortable now.
Yeah.
But I believe when Friday get here, it's just time to open up Nashville, Tennessee.
Okay. Thank you, Sharon. We appreciate the call. I'm going to keep going with a couple of calls before you respond, just to get through a couple here, Gloria. Let's go to Martha next. Hey, Martha.
Yes, sir. Good afternoon.
Hi.
My question is, if they're opening up these gyms, these liquor stores, but they're not opening up God's house.
Okay. Houses of worship.
Yes.
I think the recommendation from the state is to continue virtual services for now, and then slowly we'll get back to how that's going to look. I'm not sure, but I know a lot of people. There have been people in Kentucky who've said this infringes on their constitutional rights.
Right.
And you're ready. You're saying you're ready to get back to church.
I've been out too long. I'm ready to be back in God's house.
Yeah, I understand.
And one more thing, all these beauty shops and barber shops,
yes, ma'am.
That's those folks living. Mm-hmm. That's how they make their living.
Right.
And then the mayor don't want to open them up yet.
Yeah. I understand. All right.
I just feel sorry for him.
Okay. Thank you for your call. We appreciate it. We'll let Gloria respond to a couple of different calls there, Gloria.
Well, I understand. Let me respond first to the lady about opening up God's house. I feel her. I too, I am one of those 8 o'clock every Sunday morning, Wednesday night people. But I do also want to think about, I appreciate my pastor saying that we would do Zoom calls. We are now doing our Wednesday night study by conference call. He is doing a lot of ministers streaming it live from the Facebook, but he happens to be able to do it from his radio station to get the message over. But I think this is a time that we have to do some meditation things with ourselves, and maybe make a prayer line, make a number of people on a call so that you can pray together. But I think this is some time for us to look at some new and innovative ways of doing things, because it could be possible that we don't know what will happen. That's what concerns me. The CDC gave some guidelines. They said to make sure that we had aggressive testing, and I will say I commend Governor Lee. He is doing that in the urban areas. Needs to be done some more in the rural areas, but also to have some contact tracing in place so that new cases could be isolated. If you've got new cases, we need to know who they have interacted with. But the other thing, we need to see a sustained decrease in our number of cases. Tennessee has not yet hit its peak. And if it hasn't hit its peak yet, and we've got the number of cases we've got, we'll get a lot of cases.
And I understand people, no one wants to impede on anyone's constitutional right, and I know where so many people find comfort in their church or their synagogue or their mosque. However, I've heard some pastors say, for now, we've got a public health pandemic here, and we have to, like you said, think differently. And I heard it was a great, and I wish I remember the pastor's name, he said, make your own home God's house for now. Yes. And like you said, a great time to do some self-reflection and have some private conversations with your God. In that way, and we don't want to impede, and I understand some people we're getting to that point where we want to get back, and we want to get back to work and to church, but at the same time, again, no playbook. It's a delicate balance between, we don't want to see a new spike in cases, right?
Exactly. That's exactly right.
And especially, as you mentioned, those people, those populations who are vulnerable.
Right, exactly, and so the thing about it, the lady talked about, beauty and barber shops and etc. And I'm a diva, so I really miss that. I really miss having my nails done and etc. But again, as I go back and say again, so many things that we thought, I think, were absolutely necessary every day, we find out they really are luxuries. And yes, I think they'll figure it out. I think they'll figure out how to do it, how to open the shops and still have safe, safe distancing and keep things sanitized and etc. But I think the other thing we have to continue to say to people, if you feel that you're sick, don't go into the public. Just don't do that,
Yeah, we've got to all follow these rules together.
We must do it. We must do it. That's the only way it's going to work. And that's my fear, because I think we were just beginning to start to follow the rules. I'll say again, I still see driving, because I'll get out and just drive. I still see too many crowds. I still see people talking about having a birthday party somewhere. And that is just simply not good, because no matter how sanitary you think you are, there are some people that, and it's proven over and over again, and I think in the last few days with this inmate population, when all of these people, had no symptoms whatsoever, but they tested positive.
Yeah, exactly.
So you might not have a symptom at all, and what would you feel like, you had passed it on to somebody that was vulnerable, and they died.
And you just didn't know, right? Okay. I want to say real quick to our callers on hold, hang on. We got to take another quick break, and as soon as we come back, we're going to rattle through several phone calls. We appreciate you being patient. Stay with us. Open Line will be right back, everybody.